Remember the 344 people tested positive that I was talking about? This is a picture of Kisumu. Let me give you a breakdown, just the top 3 counties of how that panned out. Nairobi is still leading with 130. Kisumu is with 47. Uasin Gishu is 37. Siaya is 19. But this is where the focus really is, because there's a possible lockdown restricting movement in the Lake Region Economic Bloc has been highly considered as a means to tame the spread of COVID-19 in the region. So according to Kisumu Governor Professor Nyong'o, strengthening enforcement of the already announced COVID-19 protocols will continue to safeguard the population in the region, given that the COVID-19 situation in neighboring Uganda and the reality that is the country's porous borders. Raquel Mugai has more details.
Just 1 week after the county government of Kisumu issued a detailed report following a worrying increase in the number of COVID-19 infections, not leaving out the fact that the current infections are presenting very high severity symptoms. The Lake Region Economic Bloc, comprising of 14 counties in the Lake Basin region, has resolved that a circuit breaker in the form of a lockdown in the region could be the best shot in managing the COVID-19 situation.
You have to limit the movement of persons and crowding and so on as the first line of defense against COVID-19 before you go into curative services. So what we are saying is that the COVID protocols should be enforced, and not just by the government, national, county, but by individuals themselves.
The region recording 122 positive cases out of the 344 cases recorded in the country, as per the government statistics, a representation of 35% of the total cases, slightly below Nairobi's 37%, owing to the 130 cases identified in the city. But even with the governors from the region recognizing the necessary deaths and inability to cope in terms of resources, so are the medical workers citing the same. The Kenya Medical Practitioners and Dentists Union in Nyanza issuing a 1-week ultimatum to Kisumu County government, threatening to withdraw services due to lack of necessary resources to fight the virus.
I will only see a patient if I am well donned in PPE. We will not cover for inadequacies of the county government.
Medical personnel in the counties may find that there are no PPEs because for some time there's not been COVID. So we used everything that we had. There's really no need procuring PPEs if there's no need for it. So now that the surge is on, obviously there's going to be a very quick response to procuring PPEs.
And as the national and county governments strive to contain the spread of infection within the country, the challenge lies outside the country's borders. Despite neighboring Uganda having an upsurge in numbers necessitating a strict lockdown, business as usual at the Busia border point.
Something should be done for the long queue of lorries, that stretch for kilometers between Siaya and Busia, because the longer those lorries there, the more likelihood that somebody who is COVID-19 positive may pass it to the surroundings.
With eyes now set on intensifying COVID-19 protocols and testing, 350,000 doses of COVID-19 vaccines are expected to arrive in the country this week. This coming at a time when Novavax, a small American company, announced the results of a clinical trial of its COVID-19 vaccine in the United States and Mexico, finding that its 2-shot inoculation provides a 90.4% protection against the virus. Raquel Mugai, Citizen TV.